Health is the greatest wealth. It may not be a piece of gold or silver. We never value until we lose it. Hello everyone, my name is Harmeet and I welcome you to the Plant Ayurveda YouTube channel. We always care about your health and your healthy future. By these online videos, we always try to spread knowledge and awareness regarding the health issues and their treatment with natural and Ayurvedic ways. In this video, we are going to discuss about the word Hepatitis Day. So we have an Ayurvedic physician from our Plant Ayurveda team who will help us to know about word Hepatitis Day. So doctor, tell us about the word Hepatitis Day.
The World Hepatitis Day is marked on 28th of July every year, and it is observed because of the birthday of Dr. Blumberg. He was a scientist who first discovered the hepatitis virus, and later 2 years he developed the first vaccine for the hepatitis.
Okay, why WHO organizing the World Hepatitis Day?
There's a Spanish proverb that says the beginning of health is to know the disease. So WHO has taken a great initiative to spread awareness regarding hepatitis, and this is the purpose of the World Hepatitis Day also. It assigns various themes every year for the World Hepatitis Day.
Okay, then what is the theme for 2022?
Right. The theme for World Hepatitis Day in 2022 is bringing hepatitis care for the people, closer to the people. Actually, it aims to bring all the primary healthcare facilities of hepatitis nearer to the general public also, so that everyone can avail the health facilities and hepatitis can be eradicated.
Okay, the next question is, what is hepatitis?
See, hepatitis is basically a liver disease. It is the inflammation of the liver, and this inflammation can occur either due to injury or some kind of infection. The most common infections leading to hepatitis is the viral infection. Then these viral infections can be of various types depending on the virus. Basically, there are 5 types of hepatitis we consider: the hepatitis A, B, C, D and E. And these present different kind of symptoms and different type of clinical presentations also.
Okay doctor, how common is hepatitis?
See, hepatitis is a very common viral blood related infection, and almost 300 people are living with this condition. So it is very widespread, and that's why WHO has taken this initiative to spread awareness about this disease.
Okay doctor, tell us about the types of hepatitis.
Right, as I already said, it is of 5 types: type A, B, C, D and E. The type A hepatitis is very contagious and it spreads through the blood and the stools also. So we should always maintain hygiene, and intake of food should be very healthy. Plus, the food prepared should be in a hygienic environment.
Okay.
To prevent this condition, one should always get vaccinated. Then the next is the hepatitis B, which is a very severe form also. In chronic cases, it can even lead to liver damage or liver cancer also. Hepatitis B can spread through semen or body fluid and blood also. So the main transmission mode will be infected syringes usually. The next type is the hepatitis C. An infected person can transmit hepatitis C virus to a non-infective through his blood, and there is no known vaccine for it right now. It is beneficial to avoid behaviors that can cause the infection and always follow a hygienic and healthy lifestyle. Hepatitis D. Hepatitis D is basically a infection which cannot exist individually. It will require a previous hepatitis B infection. If a person is infected with hepatitis B, then only he will be infected with hepatitis T, or in some cases hepatitis B and D can simultaneously coexist also. Talking about the hepatitis E, it transmits through the stools. If there's water that is contaminated with stools of an infected person and someone takes it, he will also get infected.
Okay, doctor, then what are the risk factors and who are the more prone to this infection?
Okay, nice. See, we should always be aware of the risk factors so that we can prevent ourselves, so that we can protect ourselves from getting infected. Hepatitis basically is spread through the blood, as I said. So it should be taken care that syringes, needles are not shared at all. Plus the personal accessories such as blades and razors should never be shared, and hygiene should be maintained, as I already said. Plus the infants should be vaccinated for the hepatitis. This will be a great step to protect the child also. And also because exposure to the infected blood will cause the infection to develop in your body also. So always make sure that if there are cuts, any type of cuts, properly clean it and cover it so that there is no chance of infection in it. Also, if someone is traveling into a hepatitis prone area or where the infection is widespread, he should always be sure that he is vaccinated or should also avoid going there.
Okay, doctor, then what are the symptoms of hepatitis?
See, there can be various symptoms depending on the patient. In some cases, it can be asymptomatic also, that there are no symptoms at all. The person is feeling very well, but the infection is going on inside the body. In some cases, the most common complaints we see are anorexia. The patient does not feel hunger, plus he may feel nauseatic all the time, like he feels like he need to vomit or even vomiting all the time. Plus he feels lethargic, he does not have energy to accomplish the daily works, and also he may feel pain in various parts of the body. Basically he feels very sick, and not exactly one condition but a group of conditions also. One thing we can notice is the urine and the stool. The urine becomes darker and stool is sometimes paler. Plus this liver condition, the hepatitis, can be preceded by jaundice also for few days, and the eyes can be observed that there is a yellowish tint in the eyes, yellowish discoloration in the eyes. So these can be a bit of the symptoms that can be observed. Otherwise the symptoms will definitely vary from patient to patient.
Okay, then how we can protect ourselves from hepatitis?
See, as I said, hygiene is very important. Plus even the patients, patients that have gone blood transfusion in the recent past or the organ transplantations, they are also at a higher risk of catching this infection. So basically we have to maintain a proper hygiene, because poor sanitation will definitely lead to various types of diseases and especially infections. So maintain hygiene properly.
Okay, doctor, then what is the Ayurvedic viewpoint on hepatitis?
Right. So Ayurveda has a very unique perspective for all the health conditions. Regarding hepatitis, we can correlate it to the condition of Kamla. Ayurveda considers all the liver conditions under this category only, and liver can be correlated to Yakrit in Ayurveda. Yakrit further is considered as a sthan, adhishtan, place for Pitta dosha. Pitta dosha further is responsible for all the digestive processes in the body. And talking about hepatitis, it is the vitiation of that, the Pitta dosha, the Rakta dosha, and that Yakrit also. This will definitely lead to various disturbances in the body. The main role of our management will be to stabilize the Pitta dosha, plus improve the health of Yakrita, and improve the Rakta Dushti also. This will improve the overall condition of the body and manage the condition.
Okay, doctor, tell us how hepatitis can be treated in Ayurveda and what are the important herbs?
Right. See, as I already told you, that Ayurveda will emphasize on stabilizing the equilibrium between the three doshas, that is the Vata, Pitta, and Kapha. It will basically manage the vitiation of these, plus will try to improve the health of Yakrit, that is the liver. And to solve this purpose, there are various herbs available in our Ayurvedic texts, which can be this Bhumi Amla, Kalmeg. These are very beneficial for the liver health. Plus Arogya Vardhani Vati is a classical formulation described in Ayurveda which has various health benefits. Plus Bhringraj can be very beneficial for improving the Yakrit health. There are various other Ayurvedic formulations also which will help to improve the liver health, such as Rohitak Arisht, Punarnava Arisht, and Planet Ayurveda is preparing Yakrit Plihantak Churn also, which is very beneficial. It contains Kalmeg, Kasni, Bhringraj. These will definitely improve the Yakrit health, the liver health, and when the liver health is improved, the infection will definitely, you will get rid of the infection. So the ones willing to improve the liver health, they should definitely go for the Yakrit Plihantak Churn. You can take 1 teaspoon in the morning and 1 teaspoon in the evening, and you will definitely see the results.
Okay, great. Then I think this is the best solution for hepatitis and for our liver.
Right.
Yeah. Okay, doctor, is there any other suggestion for our viewers which will help to protect from hepatitis?
Yes. See, I always emphasize on switching on to a healthier lifestyle. One should always practice pranayam and avoid alcohol, smoking, these kind of addictions. Plus, they should try to be stress free as much as it can. Plus, there can be various herbs that can be included in your daily life also, such as Amla juice is very beneficial if you want to improve your liver health. Either you can include aloe vera juice also. Plus, you can take the Triphala powder also daily to improve your liver health, and avoid taking junk. Plus, always maintain hygiene, as I am saying it again, that hygiene should be always maintained, because poor sanitation will definitely lead to various types of diseases. Plus, see, to fight off infections, we need a better immunity, which will be solved by Giloy. Giloy is very beneficial for improving the body's immunity, so Giloy juice can be taken daily to improve that, and that will also help to manage hepatitis effectively. Apart from this diet, the lifestyle also should be healthy. One should always practice safe sex and should avoid making contact with multiple partners. Plus, avoid sharing needles, as I already mentioned, and never share your personal accessories with others, especially if someone is infected. You should take more precautions to stay safe.
Great. So thanks, doctor, for this great information regarding the hepatitis and the World Hepatitis Day. And I think we have solved and answered all the important questions regarding the World Hepatitis Day and hepatitis. And we hope that this information will help you. And this information will help you to protect yourself from hepatitis and the other virus too. And then important things that you have to care about your immunity. This is all about immunity and your liver health. Care for your life. Don't let hepatitis separate you from your loved ones. So keep watching Plant Ayurveda's online videos and improve your knowledge regarding the health issues so you can protect yourself by own self. Thank you.
हम कब से वेट कर रहे हैं यार तेरा।
आई कांट कम यार, पार्टीज के बाद मेरी तबीयत खराब हो जाती है।
प्लीज इस बार नो एक्सक्यूज।
एक सोल्यूशन है, कम पार्टी विद मी।
कहाँ?
एक नए प्लैनेट पे। खाओगे या घबराओगे? कम विद मी।
कहाँ?
एक नए प्लैनेट पे।
तुझसे ना हो पाएगा बेटा।
प्रॉब्लम बेली फैट नहीं है, प्रॉब्लम फैटी लिवर है. कम विद मी.
कहाँ?
एक नए प्लैनेट पे.
Oh God, Rohit, not again.
हाय. कब तक सहोगे ये पेन? फॉलो मी.
But कहाँ?
एक नए प्लैनेट पे. Welcome to Planet Ayurveda. Yakrit Plihantak Churna is a perfect Ayurvedic supplement that takes care of all your liver issues. It's an all-rounder health product for every age group. Log on to www.planetayurveda.com and order a full range of Ayurvedic medicines and herbal supplements. Delivered worldwide.